I'm one of the adult physicians and the nephrologist. A nephrologist is basically a kidney specialist. We look after adult diseases, and then the nephrologist looks after patients with kidney disorders. And then we also look after the patients that are on dialysis in the chronic dialysis units.
So what types of dialysis treatments do you offer at the dialysis facility, and how do they benefit patients with kidney disease?
So at this new facility at the Katutura Intermediate Hospital, we are offering hemodialysis. That is to do with where a patient gets connected onto a machine through a sort of catheter that is inserted into the patient, and that there are lines that connect the patients to the machine, and the blood gets taken from the patient, goes through the machine, and it gets cleaned and gets circulated back to the patient. So that's hemodialysis. But in the future, we are hoping to also offer peritoneal dialysis. That is another modality that a patient can do at home. They get trained to do that peritoneal dialysis intensively for the first 2 weeks, and then they can do their own peritoneal dialysis at home.
Mm-hmm. So
that requires intensive training for the patient.
Okay. So what are some of the most common causes of kidney failure that requires dialysis, and how do you plan to address this within the community with this new dialysis equipment?
So the most common causes of kidney failure in our communities is mainly hypertension, long-standing tension or blood pressure that is not controlled over many years can cause kidney disorders. And also we also noted the increasing trend in diabetes. It's also becoming quite a problem and causing kidney failure. And also other causes. They've called a multitude of causes, but the most common ones that we're seeing is hypertension and diabetes.
Mm-hmm. So,
and then these usually these disorders are usually should be managed at primary healthcare level, where the patients present to the clinic, and they usually must have their blood pressure checked, and they must have their sugar checked, and usually they will also do a urine dipstick just to see if there's any abnormalities with the kidneys. And if they pick that up, then the patient should be managed early to prevent them from going into kidney failure.
Okay. So how does this new unit enhance the quality of care for patients with kidney disease in our region?
So this new unit, it's a state facility that is catering to the state patients that cannot afford private care. So in what we've been doing for the past few years is that the state patients get referred to the private units for dialysis, and then the state sort of paid for those services. But now that we have our own facility within the state sector, it sort of cuts down the cost that the state spends for patients to be dialyzed outside. So it's an enormous. It will be an enormous benefit for spending from the Ministry of Health to cut down the spending, and that resource can be used in-house and can also help to sort of cater to other needs.
So it's the first of its kind for the public patients.
Yeah, so it's the first state facility. So we are hoping to also get the state facilities up in the different towns. So we are planning for Shakati. It's already the units are already sort of being renovated, and the machine is being procured. And then there's also plans for Rundu and Warfish Bay and Katima Mulilo and Kietmansop for those state facilities to be functioning in the near future.
Okay, so the fact that this is the first of its kind, what are some of the key challenges that you anticipate in providing dialysis care, and how do you plan to overcome these challenges?
So these units usually require intensive resources in terms of the materials that are needed to dialyze a patient. So it's to do with consumables and getting those consumables available or procured in time for the patients when they need them. So we just need to make sure that those things are available for the patients. and also the human resources to do the work in terms of nursing staff. And of course, we are 3 nephrologists on the ground, but we definitely will need more human resources to help to look after our patients.
Mm-hmm.
So it's basically to do with materials to dialyze the patients. Those need to be available, and then also the human resources to look to make sure that the unit runs adequately to look after the patients. Yeah.
Yeah. So, how many patients can the unit accommodate, and what is the expected patient turnover?
So currently, we are dialyzing about 7 patients. We've started at a slow pace because we still need to get adequate numbers of nursing staff or dialysis assistants. So we just have to build up the capacity in terms of staffing and then also additional doctors. But for now, we are dialyzing 7, but the unit can accommodate up to 28 patients per day.
Okay. So what support services will be available for patients undergoing dialysis, such as counseling or nutritional guidance?
So patients, usually when they start on the dialysis program, they need to intensive counseling, because the dialysis is a life-changing procedure, because you have to be on dialysis. You have to come to dialysis 3 times a week. You have to be on the machine for about 4 hours. So that is, it takes up the patient's time, and it also sometimes means that some people cannot do their work or they get retrenched. So it requires intensive counseling to just in terms of getting to accept the diagnosis that you've got chronic kidney disease, and then also having to accept this life-changing routine. And of course, counseling, intensive counseling, and nutritional input from the dietitians, because there's some diets that are not. You need to have advice on what to eat and what to avoid when you've got chronic kidney disease. And also, it's counselors and nutritionists, and also sometimes also social worker or psychologist with patients who cannot cope with their diagnosis. So it's a multidisciplinary approach to the patient, so we get as many people involved as possible to help the patient accept their diagnosis and to accept the life-changing treatments. And then, of course, sometimes patients get retrenched and they might need additional support in terms of maybe a grant where they have, or a disability grant where they can get this income to look after their families if they were the main breadwinners.
So maybe in closing, what message would you like to share with the public regarding the importance of early detection and management of kidney disease?
So the main thing is we advocate for prevention. It is better to prevent a chronic illness. So usually we advise the community to get checked. A once a year checkup is very important. You need to have your blood pressure checked. The sugars must be checked, and the urine dipsticks at the local hospital or local clinic, just to make sure that there's no hypertension or diabetes or any underlying kidney disease. If those things are done once a year, they can be picked up early and managed early, and we try to prevent patients from getting chronic kidney disease, and we want to prevent patients getting onto dialysis. So the main thing is that a person must get yearly checkups, just to make sure that there's nothing that is aligned that is going to cause end-stage kidney disease.